So this young 18-year-old boy came to us from Iraq. He had sickle cell disease, because of which he developed avascular necrosis in his right hip. He had been having this problem in the left as well, but the right hip had become severely arthritic with a lot of bone loss. He had lost a lot of bone in the top of his acetabulum here, so leading to damage of the bone here. And because of that, the hip had migrated up, and he had developed shortening, almost 4 centimeters of shortening in his right leg. And there was so much of pain that the hip could not be moved at all. It was almost fused. Any attempted movement caused him severe pain. He was in terrible shape, not walking, barely able to mobilize, non-weight bearing with a walker or crutches, and his life had come to a standstill. So I saw him in an OPD in Iraq and asked him to come to India for the management, because this is a very complex procedure, needs to be managed as a team. In the sense that, first of all, we have to manage him medically. His sickle cell disease has to be managed so that we can make him fit for surgery, and there is no risk of developing a sickle cell crisis during the surgery. So what we do in such cases is we get a hemoglobin electrophoresis. So that tells us the percentage of hemoglobin which has sickle cell problem. So in his case, it was 70%. We need to get it to less than 30%, so that during the surgery or afterwards, it doesn't develop a sickle cell crisis, because such patients can develop a crisis even in cases of acute pain or severe pain or any kind of stress to the body. And in that crisis, that can lead to clogging of the blood vessels at various parts of the body. It can obviously lead to damage of the spleen, damage to the bones, and which he'd already had. So it could be catastrophic. So we did exchange transfusion, in which we transfused him around 6 to 7 units of blood, which cleared out his damaged hemoglobin and gave him fresh hemoglobin and fresh red blood cells, which could last well for the next 90 days or so. And we got that percentage down to less than 20%. So afterwards, we could take him up for surgery. In such patients, the bones are also very sclerotic, they're very hard. So putting in the implants is also a very big challenge. So we have to keep all sizes of our implants, all sizes of stems ready. Typically, the smallest size of stem goes in because the bone canal is very narrow because of the sclerotic bone. So it cannot make a space for putting a big enough implant. So we have to go with whatever is the best fit implant, which usually is the smallest size. In case of acetabulum, because he had a bone loss superiorly, we had to build it up with a bone graft. So as you can see in the X-ray, we put a bone graft at top, fix it up with screws, and then we put a cup. So he's got a nice looking hip now, which is stable, which is pain-free. And after almost more than 2 years, he's able to walk, stand without any pain, and he's so happy about it that his pain is completely gone, to the extent that he has within 10 days he's trying to walk even without any support, which I've asked him not to. For the next 6 weeks is the time it will take for him for complete recovery, after which he can enjoy his life like normal. So a good outcome, and be thankful for it. Thank you.